Welcome to our video on osteofibrous dysplasia, a rare benign condition affecting the tibia. We'll explore its characteristics, diagnosis, and treatment options, providing a comprehensive understanding of this unique medical condition. Osteofibrous dysplasia primarily affects children under 10, presenting as painless anterior shin swelling. It's a benign, tumor-like condition that often regresses without causing issues in adulthood. Diagnosis involves radiographs showing an anterior eccentric lytic tibial lesion. Histology reveals fibroblast proliferation around islands of woven bone with osteoblastic rimming, distinguishing it from similar conditions. The condition is more common in males and primarily affects the anterior tibia. Genetic factors like trisomy 7, 8, 12, and 22 have been reported, but it lacks the G's alpha mutation seen in fibrous dysplasia. Patients may be asymptomatic or present with painless swelling and anterior tibial bowing. Pseudoarthrosis can develop in 10 to 30% of cases, requiring careful monitoring and management. Radiographs are crucial for diagnosis, with AP and lateral views recommended. They typically show a diaphyseal lesion confined to the anterior cortex, often leading to tibial bowing. Histological examination is essential, revealing fibroblast proliferation and osteoblastic rimming. This differentiates osteofibrous dysplasia from other conditions like adamantinoma and fibrous dysplasia. Observation is the primary treatment for osteofibrous dysplasia, as lesions usually regress over time. Bracing may be necessary if deformity affects walking, but surgery is rarely needed. In rare cases, significant deformity may require correction through osteotomy after skeletal maturity. This operative approach is reserved for severe cases impacting function. The prognosis for osteofibrous dysplasia is generally positive, with most lesions regressing and not causing problems in adulthood. Regular monitoring ensures any complications are addressed promptly. Understanding the differential diagnosis is crucial. Conditions like adamantinoma, eosinophilic granuloma, and enchondroma must be considered when evaluating tibial lesions. Fibrous dysplasia and osteochondroma are also part of the differential diagnosis. Each condition has unique characteristics that help in distinguishing them from osteofibrous dysplasia. Non-operative management is the first line of treatment, focusing on observation. This approach is effective for most patients, as the condition often resolves without intervention. Bracing is indicated if the deformity is significant and interferes with walking. This non-operative measure helps manage symptoms and prevent further complications. Operative treatment, such as deformity correction with osteotomy, is rarely needed. It's considered only for significant deformities that persist after skeletal maturity. The epidemiology of osteofibrous dysplasia shows a higher prevalence in younger children, particularly males. Understanding these demographics aids in early diagnosis and management. Genetic studies have identified trisomy 7, 8, 12, and 22 in some cases. However, the absence of the G's alpha mutation differentiates it from fibrous dysplasia. Symptoms may include painless swelling and anterior tibial bowing. These clinical features, along with imaging and histology, guide the diagnosis and treatment plan. Radiographic findings are key in diagnosing osteofibrous dysplasia. The anterior eccentric lytic lesion is a hallmark feature, often leading to tibial bowing. Histology reveals fibroblast proliferation and osteoblastic rimming, distinguishing it from other conditions. This microscopic examination is crucial for accurate diagnosis. The differential diagnosis includes conditions like adamantinoma and eosinophilic granuloma. Each has distinct features that help differentiate them from osteofibrous dysplasia. Treatment primarily involves observation, as most lesions regress over time. Bracing and surgery are considered only if the deformity significantly impacts function. Thank you for watching our video on osteofibrous dysplasia. We hope this information has been helpful in understanding this condition and its management.